I'm not a magician, I'm a pain detective. Hi, welcome to another episode of Dr. Rob, Pain Detective. I'm your host, Dr. Robert Pomahawk. And on tonight's show, we have Greg Nigro, co-founder, TerraCore Fitness, the Gym Sherpa brand, fitness consultant, and guru to athletes and stars around the world, and a dear, dear friend of mine as well. And we're back. Greg, thanks for being on the show.
My pleasure, Rob.
Appreciate it.
Yeah, of course.
So Greg and I have been friends for 15, 20 years.
Yeah.
We met in Venice Golds probably with a bunch of different mutual friends.
With a bunch of different meatheads.
Yeah, totally, exactly. So the reason Greg's on the show today is because we've both been in the health and fitness industry. We've both had numerous injuries. Greg grew up playing sports. And the reason he's here tonight to talk about inside versus outside healthcare and how he's transformed himself and what he's doing now with TerraCore.
So background in sports, I was an avid baseball player. I ran track, played a lot of basketball, played baseball in college.
Wow.
Yeah. So I was a decent athlete. I was a smaller guy though. I played ball at about 120 pounds.
Yeah, I remember that. Yeah.
So I was so skinny.
Yeah.
I wanted to gain weight, but I was afraid to really get into the weight room. So a lot of my friends were D1 football players. They were big guys, and I was intimidated to really get into the gym. So when I was in college, I had a buddy of mine who really kind of essentially forced me into the gym. He was
So when you entered college, how heavy were you?
about 115 pounds.
In college?
In college.
Wow.
Yeah.
You're not that now.
No.
So transformation,
Yeah,
right?
big time,
Yeah.
right? So
Similar to me though, because I entered high school at 115 and I left at 230.
Oh, geez.
Yeah.
Wow, man.
So people out there that are small now don't have to be.
Yeah.
So it's a testament from both of us.
It is, and I think that it took it was a lot of work on my part. At first, I didn't really know what I was doing. I was just lifting, and it took me a long time to really understand, training. I was overtraining for so many years.
What does that mean?
Well, my body was breaking my body down, and I didn't have enough, I wasn't allowing myself enough time to recover.
Okay.
So it was really hard for me I was making it harder on myself to gain the weight that I wanted to.
So were your workouts too long, too often? What was the combination? Because I don't know if people out there know what overtraining is. A lot of people just go to the gym all the time, 6 days a week. It's not the way it's supposed to be done.
Right.
And coming from us of guys that have been doing this for 30 years,
Yeah.
tell me about that.
I did upper body one day, lower body the next day, upper body the day after, and then lower body the day after that. So it was an upper body, lower body switch every other day.
So no rest.
No rest.
None.
And I didn't, I felt fine. I'm young at the time, and I feel like, well, I don't feel like I'm broken
Invincible,
down.
right?
Yeah. And I had the energy. You're thinking, okay, well, if I really worked out hard enough, I should feel like I can't do this. And I felt like I could, but I was just overtraining for so many years. I didn't get the results that I wanted.
Huh.
So, started to learn about nutrition. I started to learn about training and understanding how to do things properly. And, it was a slow learning curve for me. There wasn't a lot of information out there. And, unfortunately, a lot of the things that I think that I was doing, not just from sports, but in the weight room, led to some of the injuries that I have.
Yeah.
So, just the training that I was doing overdeveloped certain parts of my body and, caused me to kind of come forward, my shoulders to round. A lot of the other things I was doing developed, knee pain from doing heavy squats, improperly. So, the result of that has been 2 foot surgeries and 4 knee surgeries.
Yeah.
And it's just at my age.
You're not 80.
now. Huh?
And you're not 80.
I'm not 80.
No.
No,
Yeah.
but I think knee replacement's right around the corner for me.
Yeah, hopefully not.
Yeah, I hope you're right, man.
Yeah.
But that's why I come
So
to see
that's
you.
partially why you came and saw me, because
Yeah.
obviously I'm an athlete and my background was in health and fitness and sports and competitive sports. And tell me a little bit about who you were seeing prior to coming to me and why you kind of ended up seeing me instead of the people you were seeing.
Right. Well, I don't want to name names.
No,
But what I will say is that, because of the way that I had been training, my posture was off, and again, having that pain, well, naturally, what do? Go see a chiropractor.
Sure.
Right? So I went to see chiropractors, and nothing was really doing the trick for me. I'd go to a chiropractor, they'd make an adjustment, and I'd feel, decent for like the first, I don't know, hour or so, and then it was just kind of right back to, slouching. And
was there any type of diagnostic evaluation that was being done?
No.
Nothing, just come in, let me adjust you, and that's it.
Pretty much.
Yeah.
And, I remember meeting you, and we had a conversation, and so I asked around, and you have a great reputation, and so everybody's like, go see Rob, and so I did. And then when I came in to see you the first time, I remember I was blown away because you're like, do you have enough time today? And I'm like, well, I'm just getting an adjustment. That's what I thought was going to happen.
Yeah.
And you're like, no. So I remember we went through a lot of analysis, and you showed me some things that really blew me away as far as where my problems were stemming from, and then putting me on a plan and a path to actually improve, to not only improve my posture, but to reduce my pain. And I've been appreciative of that ever since, because it's been great for me.
And coming from an athletic fitness background, you know now how to work out. I mean, this wasn't when you're in high school. This is when you're in your senior life, right? As a client of mine, it's inviting to me to have these discussions with people that are in the same field as me, because you're getting it, you're understanding it. Yeah. It's also unfortunate that the people that you went prior to see weren't to the point of understanding that needs to be done to help you understand why you're having the problems.
Correct.
So when you came in, we did a posture analysis. And then we provide you with simple postural exercises to work on not your big muscles, but how to stand properly, postural muscles, right? Erectile muscles of the spine. We also did a foot analysis to see if you were putting more pressure on one foot than the other position. And then we did a spinal analysis, because when you look at how your body works, your pain is the last thing to show up and the first thing to go away. It's your warning sign. It's your check engine light. Hey, there's a problem here. I can't fix it. What's going on? And in your world, in my world, it's like, let's work through it. Let's exercise. Let's, eat better. Let's do all the things we're supposed to be doing. And we do those things, and the pains are still there.
Right.
And then you might go see a massage therapist or a chiropractor or an orthopedic surgeon. And there's really no understanding of how does my structural system, my spine, contribute to my neurological compromise that contributes to my muscles being pissed off at me and working too much. And then all of a sudden down the road, we're having these health problems. And then the worst thing about it is when you're going to the gym, your workouts aren't as effective and efficient. And then you're going, it's like, I don't even want to work out anymore. And then that whole turns into a cycle. And it's an emotional thing. And then you don't want to go. And then your wife's pissed off at you because you're cranky.
Well, yeah, and then, for me, the other thing was that my workouts were reinforcing my bad behavior, right? But the things that I was doing was reinforcing my rounded shoulders, was reinforcing my bad posture, was reinforcing the pain that I was having.
But you weren't aware of that posture until we shot a picture of you.
Correct.
Because guys in our world think we have great posture because we go to the gym.
Yeah.
That's not true.
Exactly. And then the understanding of being able to say, okay, well, I have to switch up my training.
Sure.
There's things that I shouldn't be doing.
Interesting.
Or other things that I should be doing in order to improve my physique, my posture, and to reduce pain. And so, again, it's a learning curve for me to understand, oh, well, maybe I shouldn't be doing that. I should be doing this instead. And so a lot of what the path you taught me on encouraged me to dive in and understand a little bit more deeply about the training that I was doing and the changes that I should be making if I want to really try to continue without pain.
Nice.
Yeah.
So we're going to review some of your diagnostics. That's quite a few years back. We kind of want to reveal to the people that are out there lifting weights, trying to get into shape, or having health problems, don't know who to go see. Inside versus outside healthcare. You're taking care of the outside healthcare by obviously eating better, consulting with people, making sure they're doing the things right. But still, what's your body like inside? Are you aging faster than you should? Are you breaking down faster than you should? And that's what we did for you.
Right.
So the first piece of the puzzle we're going to look at is going to be how your posture played a role. There's you, obviously, different haircut back in the day.
Yeah.
Right? So what we're looking at here is we're looking at where you are compared to where you're supposed to be. And like you said, this sort of changed how you're now probably been doing your squats, your bench press, the rolling of the shoulders. So green line is where you're supposed to be, right? Ankle, knee, hip, shoulder, ear. Muscles in front bring you forward, muscles behind bring you back. And you're the red line.
Yep.
So even fitness people have bad posture, you and me. And it wasn't until I evaluated my posture that sucked. And then it's the same thing with you. And you're like, holy smokes, I'm feeling like I'm leaning over all the time. And that's coming from baseball and the sports you played, right? It's a
Little bit.
go position. And then we're no longer playing those sports, but we're still in a go position.
Right.
And what we don't realize is that we should have more heel and midfoot pressure than toe and midfoot pressure. Because you're in the position where you're way far forward, you're just using muscles that you shouldn't be using all the time.
Correct.
And then you adapt that posture like you have here into your exercise routine, and that's where the injuries start accumulating, and then you're like, what's going on in my body? So head position, 1.83 inches too far forward. Approximate weight of your head based upon your height and weight, 12.8 pounds. But because of that shift forward, your head now feels like it weighs 36.4 pounds.
Yeah.
Almost 24 pounds of pressure forward.
Yeah.
So when your wife says you have a big head, you do.
Yeah.
Yeah.
Well, I might debate that number because there's not a lot of brain in there, right? So it's a bunch of empty space.
All right. Well,
my wife would tell me that too.
exactly. Yeah. And I know his wife's okay. And then the hand position, which most guys don't realize, is like, why are my pecs always tight? Why is my lat bothering me? Why am I having injuries in my chest and my biceps? Which we all get. We have no idea why. It's because in that position, you're rolling your shoulders forward.
Yeah.
So the internal rotators, which are your pecs and your lats, are constantly engaging.
Yeah.
And so then what most therapists or chiropractors or people out there say, roll your shoulders back, which is a weird position. You're not going to stand like that. So what I tell people is, instead of having your hands in your front pocket, put them in your side pocket.
Yeah.
By changing your hand position, disengages your pecs, your lats, and engages your external rotators and your rhomboids. Just by having that helps with that situation. Then with a head position in a forward position, what we taught people, what I teach people still currently, is give yourself an uppercut. So if you eliminate the hands in a forward position, the head in the forward position, you're now more of a state of neutral. So whenever I go to the gym, it's the same thing. Guns in my pockets, thumb straight ahead, give myself an uppercut, and then do the exercise.
Yeah.
Because you're just working way too much. And then you had a shift right here too, right? And you had knee issues, and you still have knee issues. And part of the reason we have to look at, why is it one knee and not both knees? Because our knees are the same age.
Yeah.
So usually it's an accumulation of injuries from playing competitive sports, right?
Right.
But as we get older, we're not playing those sports anymore. So if you're having that posture when you're going to the gym and doing squats and you're shifted, what's happening here? You're putting more pressure on your body.
Correct.
Look at your left hand, right? Lower than your right hand. Hands are rotated inwards. Internal rotation of the shoulders. Pecs, injuries. Why do we have injuries? Go to the massage therapist. Wonderful, relax the muscles. You go back and you have that posture. All that wonderful work goes out the window.
Correct.
Why? Because posture, good health, bad posture, bad health. So with that, we also evaluated your foot position. So we took a look at how your feet are positioned, right? And this was quite interesting and really informative because we took a look at what your feet were doing. Feet play a major role with knee degeneration and compression. So we're not going to have the knee surgery, going to prevent that from happening because of what I'm doing these days with regenerative medicine. We'll talk about that in a second.
Okay.
But we take a look at foot analysis when it comes to lower back situations, which you had, right? And then also hamstrings, quads, and also knees. So it shows that you have a very, very pronated feet, putting pressure on the inside part of your feet. Then you're standing forward, encouraging more pressure on the knees and the hips, and you're also shifted. Right. Not a lot of shift. They're pretty balanced there. But once again, what are we recommending? Insoles or orthotics. Why? Not because I'm telling you, it's because the data collection is providing that information to gear you in the right direction.
Correct.
So that's what we did for that. And then from that, we also provide you simple postural exercises that we also wanted to work on. Why? Because if you have bad posture, part of the routine that we do here is, you got bad posture, let's work on back posture by fixing it. So we learned how to implement certain body positions through the postural analysis and the spinal analysis to make you understand how you should be positioning your hips. Disengaging the quads and the hamstrings, put them in a state of neutral. Because one thing that fitness people don't realize is that, most of us don't realize, is that your muscle begins at a bone and ends at a bone.
Right.
And if your spinal system, including your hips, are not the supposed to be, in your situation, too much tilt forward, causing hamstrings to be lengthened, injuries we talked about, right? Putting more pressure behind the knee. Remember we talked about that as well, and you had those injuries. We did the massage therapy behind the knee all the time. We found it was a different problem from the different doctor, but tight quads. And then you wonder why athletes pull their hamstrings all the time, right? It's because they're constantly in a state of engagement or lengthened. And then it's interesting when I go to the gym now and I watch people do squats, it's like, don't do that. Right? Because we're always in that position. We're putting so much pressure on our L5, S1, disc herniations, things of that nature, because we're taught from our grandfather's trainer, from that person's trainer, and we're not doing it correctly. Just take an analysis of what your structural system's doing to modify your workouts. So that's what we did for you as well.
Yeah.
So we gave you some butt kickers in terms of keeping your pelvic neutral, had a head flexion position, retracting that. Because your hips in a flex state, we want to retract them back. How to do squats on a vibrational plate, bringing the curve back in your neck, which we'll show you in a second. Head position, tilting to the left, we want to bring it to the right. Scapular retraction exercise is really simple to do. Why? Because we're constantly rolling our shoulders forward. These are not very difficult exercises, but unfortunately, if we're not retraining our system because you've been practicing your posture for so long, how do we untrain them?
Right.
It takes a long time to untrain them. So simple things that you're now still doing is making huge effects.
Correct.
Cool. Got that so far?
Yeah.
Cool. Been a long time, but
Yeah,
I'm glad you're still doing it.
I'm looking at this and I'm going, man, yeah, I remember all that.
Yeah, right.
And it's been great because, I've had to make a shift in my training. And, a lot of the problem for a lot of people is just getting out of it's just changing the mindset, right? Sometimes these things aren't sexy.
No.
Right?
They're not.
They're not sexy.
They're boring.
And it's like there's not a lot of weight involved, or it's not something that's going to turn heads.
Ego.
But if you can release that and really focus on what is important in order to really get your body back to where it should be, unwinding that the years of that, the training, especially that I was doing, and you'll feel so much better. Yeah. You'll perform better.
Yeah, isn't it amazing that we're at the age we are now? Yeah. We actually feel better and look better, even though we beat the poops out of ourselves for so many years. Like, this has got to change.
And what I can say is, and you and I haven't spoken in a minute, but the amount of pain that I have has been greatly reduced. Nice. I mean, I sleep at night. I can sleep through the night without, waking up with, something, with like feeling like my shoulder's going to pop out, or that my knee's just going to, something's snapping. It's really nice to feel better. I haven't felt this good in years.
It's kind of amazing.
Yeah.
Yeah. Thank you, Los Angeles, right?
Yeah, right.
Yeah. So structural system here, we're looking at your neck. Neck wasn't ever bad, so we took a picture of your neck. Why? Because we do a full postural analysis of the muscle system.
Right.
Hence, we do a full spinal analysis, structural analysis to see how the neck, the mid-back, and the lower back, and the tailbone are all working together. Because if you're bringing your head in a forward position, that has to also be addressed through making sure that you're making modifications in your posture to help with that. Right. And then we also took a look at your mid-back. Mm-hmm. So left picture is your neutral picture, your normal picture. This probably shocked you when you saw it, right?
Yeah.
This is a picture of your mid-back facing to the left. The green line is where you're supposed to be. The red line is you hunching over like an old guy, right? And you wonder why you're having lower back, shoulder problems, pec problems, right? Because you're just so hunched over all the time. And then you get to the gym and those muscles are just constantly firing because you just want to stand properly. And you can't because all those muscles are trying to counterbalance, and you're wondering why you can't develop muscles.
Right.
And then you're overtraining. Not anymore, but in the past.
Yeah.
So we worked on that by what? Opening up a little bit, just finding better posture, not looking down at your phone all the time, bringing your phone to your head when you're driving your car, making sure that you're in a neutral position, not, trying to be cool because we don't need to be anymore, right? So paying attention to posture at all times, right? And that's partially why you transition into things you're doing now with, Vicor and TerraCore, which is an amazing brand, which we'll talk about in a second.
Thank you.
Yeah. And then your lower back. So in your lower back here, this was pretty crazy right here.
Yep.
Green line versus red line, picture of a lower back facing to your left. The structural system of the lower back is supposed to be 40. You're massively overly increased right there. Your tailbone angle right there is supposed to be 40. Too much curve right there. So when you're having too much curve in your lower back and too much curve in your tailbone, that's causing something called facet syndrome. Boom. So right there, what happens is why you're having compression at the different parts of your body is because if you take a look at right here, right, what happens to that disc right there, that nerve right there, and these bones are shifting because you have too much of a curve. It's compromising that whole area, causing disc herniations. Disc herniations or disc bulges are not age-related because every bone in your body, every disc in your body is the same age as you. So why do people only have one disc problem? Yeah. It's because it's abnormal loading from this bone and this bone on this disc because of the angulation change, putting pressure on that nerve. Now, 50% of people that have disc herniations don't have pain. In your situation, we had knee problems as well and hamstring problems, so there's a correlation with that. Yeah. The main culprit behind why you have pain is actually these bones right here. They're called your facet bones. So one thing you probably didn't notice is that, look at those bones right there, how they overlap.
Yeah.
That's a primary driver of pain. It's called facet syndrome. What's actually happening to that bone structure is a healthy position, beautiful joint spaces. It's working beautifully, blue, nice, overlapping over a long period of time, causing inflammation, driving pain to that nerve.
Got it.
And when you're having that increased curve of your structural system, what's actually happening here is L1, out of alignment, hip flexor problems, which we're all taught, stretch your hip flexor, stretch your hip flexor. Well, your structural system controls that. So it doesn't matter how much you stretch it, unless you're engaging the nervous system that's controlling that muscle to make it in a neutral state. Guess what? Keep stretching it, nothing's going to happen.
Correct.
Quads working too much, knee issues, right? Quads get an L3, L4, and they get the hamstrings, behind the knee problem, right? We constantly worked on that in massage therapy. Why? Because it's a problem. We also did structural pathology correction, right? We also did work on the bottom part of your legs right there. And then also those problems right there. And then we also shot your knees. Why do we shoot your knees? Because you had knee issues. We wanted to see what was going on with your knees. Why? Because I can't see inside your body.
What?
Can't. I'm not a magician. I'm a pain detective. So we look at this picture right here. They're not that bad. Now, this isn't that long ago, okay? But once again, because of your postural position, your foot position, which we showed how you're pronating your feet, you're having some abnormalities.
Correct.
In the past, what would probably happen, like you said, is knee replacements, right? You're still in a situation where we can regenerate that tissue in there by doing combinations of stem cells, PRPs, exosomes.
Yeah.
And partially why I got involved in that industry is because I've had tons of problems and I didn't know how to fix the problems I was having with what I was just doing. So I spent the last couple of years researching, going to school, communications with different doctors that have been doing regenerative medicine for 10, 15, 20, 30 years. Now on my team, I have those experts. I have an expert ortho that specializes in regenerative medicine. I have an expert researcher for 15 years that lets us know case by case study, MRIs, x-rays, what should be done to properly heal your problem. So instead of tearing down and replacing and cutting, now we're regenerating tissue. Yeah. So when you're going to think about getting the knee replaced, come and see us again, and it'll fix your knee.
Sounds like a plan. I'm
kind of cool, right?
Yeah, I would do that over a knee replacement any day.
Yeah, totally. Yeah. You don't have to. Now, once again, there's a grading system. So taking a look at your knee situation, you have to determine where and how far along are you when it comes to knee generation. Yeah. So there's a grading system, and everyone should have that. You know, are you neutral? Are you grade 1, grade 2, grade 3, or grade 4? Research shows that if you're at grade 4, the chance of regenerative medicine fixing you is about 30%. In grade 3, about 60%. But before that, grade 2 or grade 1, which you're in that category, it's a very highly likelihood that regenerative medicine can heal your knees to prevent you from having problems. So you're not that far along where you have to get your knees chopped in pieces. Okay. So congratulations.
Thanks.
Now, from all these injuries you've had, you know, we've been working together for quite a while. We know each other. How did you get involved in what you're doing now? So let's talk about that.
You know, I've been in the fitness industry for 20 years. And, you know, I was the VP of franchising for Gold's Gym. Yeah. And then held some leadership positions with some different manufacturers. And then there was came an opportunity where I met my current business partner, who is an inventor. And we kind of created this product called the TerraCore, which is a reactive product. It helps establish and build core strength. And one of the great things about it that I really enjoyed is because I was having so much pain, it's one of those things that you can utilize to not only help with correcting the pain, but it alleviates some of the pain, right? So has a nice soft surface on it to where, you know, if you have back problems or back pain, you're laying down on a hard bench, this is super comfortable and soft. And so those were kind of things that my mind at the time, because I was experiencing those pain points, that when we created this product, it was kind of in the back of my mind as far as, you know, a demographic. Need, right? As a demographic to target, because I knew that I was.
Is that what you know, right?
100%. 100%. So that's what we did. We came up with a product called the TerraCore, and, you know, it's been amazing.
Yeah.
Yeah.
I mean, I've used them in my gym when I had one in the past. Why?
Yeah.
Because it's amazing when you do a bench press and you're on a regular bench and then you use your product and how much more stability you need to do to even lift half the weight, which
Right.
reduces the risk of injury on your shoulders. Get the ego out of there, but in understanding how left versus right in balance, and when you are having problems, it accentuates that even more, realizing, you know what, I got a problem with my right shoulder, my right pec, I should get that checked out.
Yeah.
And that's when they come and see me.
Yeah.
You know, so it's pretty cool. And then we transition to another piece of equipment. So let's show a video over here for you.
Okay. Brief breakdown of the TerraCore.
This is a brief breakdown of the TerraCore. Imagine a product that makes working out fun and effective for all fitness levels.
A wonderful app that I use when I'm at home when I can't get to the gym. Why? Because it got my workout in. It's a piece of equipment that's amazing to use where I do my squats, my lunges, my sit-ups, work on my triceps, my pecs. It's amazing how you don't need anything to have a great workout in my gym, in my office.
Yeah.
Yeah.
Yeah. I mean, what's great about that, you know, that reactive surface, and you mentioned bench press, right? So just as a simple tool, doing a bench press on that, you don't need the kind of weights that you and I would need on a traditional bench to get a good workout in, right? You know, you're probably throwing up, what, the 200s?
Yeah.
You throwing up the 200-pound dumbbells?
I did, yeah. back in the day, I did actually. Yeah,
Right?
I was that guy.
I wasn't quite there. I was at the 100 and the 120s, but still, you know, throwing up those kinds of weight puts an enormous amount of pressure on your joint, you know, on the shoulder. And so I didn't want to train because I knew that the night that I tried to get sleep after bench pressing, I would not sleep.
Yeah.
I would be in so much pain. And so what's great about the TerraCore is I can lay down on that and I can use half the weight. I can use 40-pound dumbbells or 50-pound
and still engage your pecs even better and still get the pump and still look good.
Exactly, but not just my pecs, because on the traditional surface or bench, you're really isolating. And the TerraCore forces your muscles to work together in the way that they were designed, because you have to stabilize first. So I'm not just getting the pectoral activation, I'm getting abdominal activation, I'm getting bicep, tricep, shoulder, like in order to keep my body stable as I move through. I'm activating more muscle tissue actually than I would be if I was doing 100-pound dumbbells on a traditional surface. Yeah.
And then athletes are also using your
Oh,
equipment,
yeah.
right? So tell me a little bit about that.
Yeah. So I'm pretty proud of this. So we're in the Lakers as an example. We're in the Cleveland Browns. So we're doing a lot of different things with professional athletes. And as a matter of fact, you're going to appreciate this, but we just did a big test with Hockey Canada.
Nice.
They love it.
Being Canadian, being a hockey player.
I knew you would enjoy that.
Exactly.
Right? So yeah, I think a lot of sports teams, professional sports, from soccer to football to hockey to baseball, they're seeing the benefit of the TerraCore in building core strength and training in a way that is more beneficial to the athlete as far as injury prevention is a big piece of that, right?
Post-injury.
Yep, correct, or rehab. And that's one thing that the TerraCore does brilliantly is, it depends on, you can use it in so many different ways, but a lot of different athletes are using it in a lot of different ways, and it's so cool to see. So when I go on Instagram and I scroll through it, and you see something at Proactive, or you see something with Gunner down at the Lakers, and I'm hoping we'll get our Hockey Canada, we'll start picking up the product soon. We've been sold out ever since we went on Shark Tank.
Yeah, so let's talk about that.
It's kind of cool.
Congratulations.
Yeah, I got my Shark socks on today.
Right. Three weeks ago, right?
Yeah, about 3 weeks
Let's talk
ago.
about that. That's amazing. Congratulations.
Thank you.
I've been using this equipment for, 7-8 years now. Right?
You were one of the first ones to get on board because you saw the benefit of what we were doing.
Because I was having those injuries just like you were. I was like, I can't keep doing this, and I want to have my workouts. I want to feel the pump. What can I do? Oh, this is cool.
So I appreciate that. So now the kind of America and the world's gotten to see what you originally recognized as being so beneficial. And so we were.
I get a cut now because I'm no.
Yeah. So we were on Shark Tank about 3 weeks ago. We aired. It was tremendous. It was incredibly successful. We got 4 out of 5 offers from the sharks,
Wow.
and we ended up walking away with who I arguably think is the best shark, was Lori Grenier. So we got to deal with Lori, and we're in negotiations with her now to figure out what our next steps are. And I think the future is really bright. So we're very excited.
And then we're taking on a new venture together as well.
Yes.
Why? Because in my world, it's posture analysis, pain management,
Yes.
lower back issues, hip issues, upper shoulder issues, neck issues. So we're now developing a program that's revolved around what you guys are doing with me to develop upper and lower cross muscular imbalances
Yes.
treatment. So that way, if you are a physician and you're working with pain management, you don't need a big gym. Right? You don't need all this equipment. You need 1 or 2 pieces or 1 piece that's attachable with different pulleys to add resistance and to work on upper and lower cross.
Correct.
So I'm really excited about that as well, to kind of take a look at how I can implement this into my office, which we've been talking about for a while, finally going to get there. And I'm super excited about working with that, putting together an app, putting together exercises. So that way someone comes in, boom, here are your 6 exercises, here's your 8 exercises. Do them here, do them at home. Guess what? Results, everyone's happy. We win, they win, patients win. Wonderful situation where they can now not be afraid of going to the gym like you and I were, right? A lot of people that are injured don't want to go to the gym. Now you can do stuff at home.
Correct.
And then transition to then go to the gym, because now you understand your posture. You transition out of the pain state, which we've taken you through, into the active lifestyle phase, which is working with you guys.
Okay.
So I appreciate that as well.
Yeah, I'm excited about that.
Cool.
It really is.
What's the future holds for you? What's going on next?
Well, right now, man, I'm just trying to get more TerraCores in.
Yeah.
The Shark Tank thing blew. I mean, so when we aired on the East Coast, we were sold out before we aired on the West Coast.
Wow.
And we've sold through. We had product on order. We've sold through all of that. We made another order with our factory. We've already sold through that. So, I mean, you place an order today, you won't be able to get a product TerraCore till February.
Wow.
Yeah.
What do you think?
It's a good problem to have, but it's a problem nonetheless.
What do you think it is about this product that was just not there beforehand? I mean, what do you think this is now invigorating people to kind of do this? Like,
Nobody saw it.
Yeah.
Nobody saw it. We were a small business. We were funding it with our own money, which we didn't have a lot of. So every dollar that we had and that we were making was going back into inventory, because in order for us to grow the business, we needed more inventory. And that was our big problem. We couldn't get the inventory we needed. And because of that, we spent nothing in marketing.
Yeah.
So we couldn't tell the world about our product.
And now you have.
So exactly. And then now it's like, oh, everybody sees it and they go, this is amazing. Now we're blowing up. And now we're actually able to put some money into that marketing to kind of show people what it is that we're doing, how great the product is, the free app, what I'm doing with you. And we'll be able to put that into our free app as well. The education that we have now, and we're really continuing to grow because we have resources.
What I find fascinating about this piece of equipment that I still use today is how difficult it really is. Even if you think you're like great shape, it's challenging.
It
really
can be.
is. So it's pretty amazing that something that's so simple can be used anywhere, really challenges your entire body to have a great workout. It doesn't take a lot.
It doesn't. And that's one thing that a lot of people make comments about is from somebody who's obese, they love it, right? Because it's comfortable for them.
Sure.
A larger person or heavier person who goes to lay down on a bench or something like that, that can be painful for them. The TerraCore has that beautiful air surface. So just laying on that, there's no pain.
Opens up your spine too.
And it opens up your spine. It gives you kind of that reactivity. So you can start slowly with this product. But then, fast forward, you can ramp that up to where the professional athlete is, and you can really challenge yourself. So what's great about the tool is there's a lot of progressionary work that can be done. So simple, basic, intermediate, advanced.
And that's why we're implementing to my systems as well. So, Greg, hey, appreciate you being here.
Rob, thank you.
It's been a long time since we've known each other, and I'm happy for your success. And
thank you. Happy for yours as well, and I appreciate being here.
Yeah, man.
Thank you.
So that wraps another episode of Dr. Rob, Pain Detective. We'll see you guys next week.
This is a brief breakdown of the TerraCore. Imagine a product that makes working out fun and effective for all fitness levels. Comes with your very own personal trainer and an unconditional lifetime warranty. At 28 pounds and 46 inches, the TerraCore is a fully functional bench. Right side up, the surface is comfortable and reactive. Flip it over, you have 2 push-up handles, sidebars, and band bridges for endless exercise options. All these exercises are possible and so much more because the most important component is you and your creativity. The TerraCore Fitness app is easy to use. Download today and try daily workouts, visit the exercise library, and compete in monthly challenges. So let's get started. Join the tribe today.